Basics of Health Insurance, Chapter 4. Chapter 4 objective on basics of health insurance is 1, for you to be able to describe the history of insurance in the United States. 2, explain the reasons for the rising cost of health care. 3, discuss how the Affordable Care Act reforms health care. 4, discuss the legal principles of insurance and state the 4 concepts of a valid insurance contract. And 5, explain the difference between an implied and express healthcare organization patient contract and discuss different types of patients. 6, discuss how insurance works and define common insurance terms. 7, list and describe the choices a person has when it comes to choosing and obtaining health insurance. 8, describe the types of health insurance coverage, including federal, state, and private health insurance plans. And 9, explain the life cycle of an insurance claim from date of service to third-party payer processing and payment. And 10, list the type of computerized signatures for documents and insurance claims. And 11, describe the proper information to post to the patient's financial account after claim submissions and patients received. The history of health insurance in the United States. Insurance is one of the world's largest businesses. Health insurance offsets the cost of illnesses and/or injury. Escalating medical costs have limited insurance coverage options. And then patients may have more than one insurance policy to defray healthcare costs. Health insurance is a contract between the patient and the third-party payer or government entity. Managed care organizations gained popularity in the 1980s to help control the rising costs of healthcare. And remember, patients can always have more than one health insurance plan. To deal with the rising costs of healthcare, the federal government adopted cost containment legislation for the Medicare, Medicaid, and TRICARE programs. Many new insurance plans arose across the nation to control the costs of medical care and help those who could not afford insurance. Managed care principles were recognized as a method to help control the rising healthcare expenditures. Healthcare reform. Major reconstructing of the U.S. healthcare system was necessary during the 1990s. The Patient Protection and Affordable Care Act and Healthcare and Education Reconciliation Act of 2010. Major reconstructing was necessary because a growing percentage of Americans were not covered by private or government insurance, among other reasons. The PPACA was signed into law on March 23, 2010. The HCRA was signed into law on March 30, 2010. These laws, together referred to as the Affordable Care Act, was put into place comprehensive health insurance reforms that hold insurance companies accountable, lower costs, guaranteed choice, and they enhance the quality of healthcare for all Americans. The implementation of the Affordable Care Act began in 2010 and will continue through 2020. The ACA helps make healthcare available and affordable for the 32 million Americans who are without insurance coverage. Under this plan, 94% of Americans will be insured. The individual mandate. ACA requires most Americans to have health insurance coverage or face a penalty. As of June 28, 2012, the Supreme Court upheld the PPACA in its entirety. In 2015, the fine per individual without health insurance is $325 per individual, or 2% of the taxable income. This number rises to $695 per individual, or 2.5% of income in 2016, and will be reconfigured year-to-year basis on a cost of living adjustment. The health benefit exchanges. Under the PPACA and the HCERA of 2010, State-based American health benefit exchanges and small business health option programs. Exchanges must be established and open on January 1st of 2014. The exchanges will be a central clearinghouse in which an individual can compare prices and select plans from different tiers of coverage. Plans can be purchased through the clearinghouse to take advantages of federal subsidies. Individuals who receive coverage through an employer will continue to select purchase plans as they do now. Individuals and small businesses of up to 100 employees can purchase qualified coverage, and states can allow businesses with more than 100 employees to purchase coverage beginning in 2017. Legal principles of insurance. Keeping up to date on healthcare plan policies and procedures is essential. For considerations in valid insurance contracts is 1. The person must be a mentally competent adult and not under the influence of drugs or alcohol. 2. The insurance company must make an offer, is the signed application, and the person must accept the offer, the insurance or the policy, without concealment or misrepresentation of facts on the application. 3. An exchange of value, the first premium payment submitted with the application, known as a consideration, must be present. And 4. A legal purpose must exist, which is an insurable interest in the case of a health insurance policy. Implied or express contracts. Implied contract is not manifested by direct words, but implied or deduced from the circumstance, the general language, or the conduct of the patient. Most physician contracts are implied. An example of this is if a patient is unconscious when treatment is rendered, this will be considered implied. An express contract can be a verbal or written contract. The insurance policy. Major medical are extended benefits contract to offset large medical expenses caused by prolonged illness or serious injury. Insured is an individual or an organization protected in cases of loss under terms of an insurance policy, also known as the subscriber, the member, the policyholder, or the recipient. Policy renewal provisions. There are 5 classifications. Cancelable, which are policy grants to ensure the right to cancel the policy at any time and for any reason. The insurance company notifies the insured that the policy is canceled and the refunds in any advance premiums the policyholder has paid. The optionally renewable policy is the insurer has the right to terminate coverage on the premium or anniversary date. The insurer may not cancel the policy at any time in between. Conditionally renewable are policies that grant the insurance companies a limited right to refuse to renew a health insurance policy at the end of a premium payment period. Reasons stated in the policy may relate to age, employment status, or both, but may not relate to the insured's health status. The guaranteed renewable classification is desirable because the insurer is required to renew the policy as long as premiums payments are made. However, these policies often have age limits. And then the last one, the non-cancelable policy, is the insurer cannot increase premium rates and must renew the policy until the insured reaches the age specified in the contract. Some disability income policies have non-cancelable terms. Policy terms. The premium. Monthly, quarterly, or annual fees to keep insurance active. A deductible is a specified amount of money paid each year before the policy benefits begin. Coinsurance and copayment. Coinsurance is the cost-sharing requirement in which the insured assumes a percentage of the fee, and the copayment is the specified amount for covered services that the patient must pay at the time of service. Insurance billing specialist abstracts information from the patient record to code diagnoses and services rendered, complete insurance claim forms, post entries to patient's financial accounting record, also known as the ledger, and follow up on all unpaid claims. Coordination of benefits. When the patient has more than one insurance policy, this statement requires insurance companies to coordinate the reimbursement of benefits to determine the primary and secondary carriers. It prevents duplication or overlapping of payment for the same expense. Now, there's also something called the birthday rule or the birthday law. That means for the dependent children, the primary carrier is the parent whose birthday and month come first in the calendar year. They would be the primary policy holder. General policy limitations. An exclusion. That is an injury or illness that is not covered by the insurance policy. Some examples could be attempted suicide, military service, on-the-job injuries, which means that it would go to their workers' comp carrier, fertility coverage, pregnancy, and pre-existing conditions. A pre-existing condition is a condition that the patient had prior to getting health insurance coverage. Pre-approval. Some requirements for pre-approval will be eligibility, pre-certification, pre-authorization, and predetermination. An excellent way to be sure all necessary information is at the hands when you're calling for pre-certification. Most insurance policies require pre-certification prior to surgical procedures, tests, and hospitalization. Choices of health insurance. A group contract is any insurance plan by which a homogeneous group is issued under a single policy that is issued to either the employer, the leader, with individual certificates for each member. An individual contract is specific to an individual and or dependents, as a prepaid health plan is a program in which a specific set of health benefits is provided for subscribers who pay a yearly fee or fixed periodic payments. With your group contract, it falls into place with your conversion privileges, income continuation benefits, medical savings account, health savings account, health reimbursement accounts, healthcare flexible spending accounts, and high deductible health plans. And then you have your individual contract. Types of health insurance coverage, also referred to as third-party payers. This will include government plans, private insurance, managed care contracts, and workers' compensation. The competitive medical plan, also known as CMP, is a type of managed care organization created by the Tax Equity and Fiscal Responsibility Act of 1982. This federal legislation allows for enrollment of Medicare beneficiaries in a managed care plan. Then your disability income insurance. Disability income insurance is a form of insurance that replaces income when the insured is unable to work as a result of illness, injury, or disease. Exclusive Provider Organization, your EPO, is a type of managed healthcare plan in which subscriber members are eligible for benefits only when they use the services of a limited network of healthcare organizations. Your EPO combines features of both health maintenance organizations and the preferred provider organizations. Your HMOs is your health maintenance organization, is an organization that provides a wide range of comprehensive healthcare services for a specified group at a fixed periodic rate. The emphasis is on preventative care, and your healthcare organizations are prepaid by capitation. The indemnity healthcare or individual practice associations are referred to as a fee-for-service health plan. They are designed to allow patients maximum flexibility and choice when it comes to healthcare organizations. The subscribers pay a fixed monthly premium, and services are paid at a percentage of covered benefits after the annual deductible is met. Then your independent and individual practice associations is a type of managed care plan in which a program administrator contracts with a number of healthcare organizations. These organizations agree to provide treatment to subscribers in their own offices or clinics for a fixed capitation payment per month. And then the maternal and child health care program is a state and federal program for children who are under the age of 21 years of age and have special health care needs. It assists parents with financial planning, and the MCHP may assume part or all the costs of treatment depending on the child's condition and the family's resources. Medicaid. Medicaid is a program sponsored jointly by federal, state, and local governments to provide healthcare benefits to medically indigent persons on public assistance, aged individuals who meet certain financial requirements, and or are disabled. Some states have expanded coverage for other medically needy individuals who meet special state-determined criteria. Medicare is a national four-part program. It consists of Hospital Insurance System Part A, Supplementary Medical Insurance Part B, Medicare Plus Choice Program Part C, and the Medicare Prescription Drug Plans Part D. It is for individuals who are at least 65 years of age. It was created by 1965 amendments to the Social Security Act and is operated under the provisions of the Act. The benefits are also extended to permanently disabled people and those with end-stage renal disease. The Medicaid is a program that covers those persons eligible for both Medicare and Medicaid. In some areas of the country, dual coverage in both programs may be referred to as Medi-Medi. The Point of Service or POS plan is a managed care plan consisting of a network of healthcare organizations and hospitals that provides an insurance company or employer with discounts on its services. Patients can refer themselves to a specialist or see an out-of-network healthcare organization for a higher copayment. Your preferred provider organizations, the PPO. This is a form of contract medicine by which a large employer or any organization that can produce a large number of patients contracts with a hospital or a group of healthcare organizations to offer medical care at a reduced rate. The state's Children's Health Insurance Program, also known as SHIP, is a state-sponsored program that provides free or low-cost health coverage for low-income children. Then you got TRICARE. TRICARE is a government-sponsored program that provides military and non-military hospital and medical services. It covers spouses and dependents of active service personnel, retired service personnel, and their dependents, and dependents of members who died on active duty. Active duty service members are not eligible for TRICARE, but have benefits like TRICARE Prime, in which the Department of Defense covers all allowable charges for medically necessary care. Then you have the Unemployment Compensation Disability or State Disability Insurance, SDI. This is an insurance that covers off-the-job injury or sickness and is paid for by deductions from a person's paycheck. This program is administered by the state agencies in only 6 states. The Veterans Health Administration or Civilian Health and Medical Program of the Dependent Department of Veterans Affairs, known CHAMP VA. It is administered by the Department of Veterans Affairs. The federal program covers medical bills for veterans with total, permanent, and service-connected disabilities and their spouses and dependents. It also covers the surviving spouses and children of veterans who died as a result of a service-connected disability. Workers' compensation insurance is a contract that insures a person against on-the-job injury illness. The employer pays the premium for his or her employees. Handling and processing insurance claims. Some offices may do a combination of all methods to submit claims. The electronic billing is becoming more common due to HIPAA regulations for claim submission. Your smaller offices may still complete claims manually. The entire billing process can be related to simple and complex medical cases. Some manually preparing claims for submissions will be using the CMS 1500 claim form, contracting with an outside billing service company, or the direct data DDE in the payer system. The life cycle of an insurance claim starts with patient registration form, also known as pre-registration. It will have the patient's name, first, middle initial, and last, the street address and telephone number, the business address, telephone number, and occupation, the email address, the date of birth, the person responsible for account or the insured name, social security number, the spouse's name and occupation, the referral source, example could be a physician's name, the driver's license number, emergency contact information, and insurance billing information. Patient signature requirements. With the electronic environment, the electronic billers are permitted to obtain a lifetime authorization from the beneficiary. The patient signature codes are used on electronic claims to indicate the type of signatures on file for the patient. And in the paper environment, patient signature for the release of information in Block 12 is no longer required. The encounter form. The encounter form is attached to the patient's medical record during an office visit. It combines a bill, the insurance form, and a routing document. It can also be a computerized multi-purpose billing form to input charges and diagnoses into the patient's account. The provider signature on acceptable formats. A physician's representative signs insurance claims on behalf of the physician. The physician must authorize a representative to do this with a legal binding document. The representative must sign claims in a legally responsible manner, or he or she could face fraud or abuse. A handwritten signature are actually written by the physician. The signature stamp are ink stamps with the provider's signature. Electronic signatures use a key entry or a pen pad to capture the live signature. A pin, a series of letters, electronic writing, voice, computer key, token, or fingerprint transmission. Our digital signatures are lines of text or a text box with the signer's information that attaches from within a software program. The life cycle of an insurance claim. Insurance claim follow-up. Electronic systems should generate a log of claims. Put the necessary information in the patient's financial record. Now, the information that should be included in that patient financial record is a copy of the complete patient information form, the patient authorization or signature on file, copies of insurance cards, insurance correspondence, explanation of benefits, a remittance advice, logs of telephone calls and actions taken regarding insurance or collection, encounter forms, referral, authorization slips, day sheets, and deposit slips. Aging report. This is used to obtain total accounts receivables amounts, also known as AR. It shows a snapshot of how much money is due from each patient, and they're also known as a tickler file. And that is a file that contains information about pending claims that require follow-up. Deposits payments received means that checks and cash should be deposited into the bank using a deposit slip. Funds may also be transferred directly from the payer to the provider via electronic funds transfer. Even after payment is received from the provider, the patient may need to be billed for any remaining charges. Keeping up to date. Make a folder or binder of pertinent insurance information. Keep well informed by reading Medicare, Medicaid, TRICARE, and local bulletins. Attend workshops. Become a member of an association and read its newsletters, such as the AAPC, the AMBA, the MAB, etc. And also make good use of the internet. And this completes the lecture for Chapter 4, Basics of Health Insurance.